if we were to have a dorsal subluxation of the navicular, right? This thing has gotten kind of jammed up this way. That's probably the most common one that I see. The very simple way of treating this is with a simple thrust technique. So let's have you kind of sit up here, sit up this way, and have you actually reach around and grasp onto your leg and get it back. Straighten this one up here. There we go. Now we're talking. Okay. So she's going to lean back. That's going to give me a little bit of traction at that talonavicular joint. Okay, as I'm holding the navicular down. So what I'm going to do here as the therapist is I've got a couple things that I want to think about. There's a lot of skin here, right? See all that? So we need to produce some sort of skin lock here. Start more laterally and roll more medially, or start more proximally and slide more distally, something like that. And then we're going to come over the navicular like so. Take up whatever slack we have in the joint, and probably, in this case, in the table. Come over the top. I'm using my hypothenar eminence now over my thumb, and I'm just going to thrust down toward the floor, down toward the table. Okay? That's
your thumb on,
yeah,
foot is
so
on
my,
what structure?
So my thumb here is going over the navicular. Right like that. Now I'm just placing my hypothenar eminence over that. So my thumb, what my thumb is doing is it's taking up the skin lock. Right? And now I'm coming over the thumb to produce my thrust with the opposite hand. Okay, so this hand is essentially stabilizing her traction that she's putting on there for me. Taking up the skin lock, and then I come over with the opposite hand, thrust down toward the table. Obviously, I don't really want to do that to somebody who doesn't have a restriction in that direction, because I don't want to ding something up on the arch of the foot. Okay? We all good there? All right. Next thing. Let's reach that way just a touch. There we go. There's a couple ways to do this, but my favorite way to do this for a loss of adduction, adduction, is with an osteokinematic manipulation. Okay, so what I would do, it's very similar to the subtalar technique. We've all now become experts on our surface palpation, right? So we can find the lateral edge of the navicular, right? That's going to be on the medial side of the sinus tarsi, right? Find that lateral edge of the navicular. I'm going to put my thumbs over that. I'm going to block the calcaneus and the talus right here with my fingers. And then I'm just going to produce an adduction whip. Like that. So I'm throwing it away from myself, letting this just go over my fingers. Pretty simple, right? At least I make it look that way, apparently.
Say one more time for me where you're